And, you know, Paul, I want to start with you because I mentioned that your book was an eye-opener. What is the new health insurance solution that, you know, all of us, especially pre-Medicare, should be aware of? What are the solutions that are out there that we should know about?
The primary solution is that everyone should get health insurance independent of their employer. Health insurance should not be tied to a job, especially because very few people keep that same job until age 65. If they find themselves fired, retired, or just want to early retire before age 65, the greatest missing hole in their financial plan is how do they get health insurance between age 55 and 65. In contrast, if they bought an individual plan without an employer before that happened, an individual plan, you're locked in based on your health. You get underwritten, you get looked at, and in 46 states you get a very cheap rate if you're healthy. But then if you get unhealthy, your premium cannot be raised because of illness. It will go up with your age, and it will go up with general inflation, but you can have $1 million claim and they can't raise your premium 1 penny for it.
All right, so let me stop you there. If I am covered by my employer, do I drop it?
Mixed question.
Yeah.
How are you covered by your employer and who's paying for it? Most major companies pay for the employee, but today require the employee to do withholding to pay for 50 to 100% of their spouse and children.
Right.
If you have a healthy spouse and healthy children, run, don't walk, and get them an individual plan. It will be much less money than your employer plan if they're healthy, and now you've got them permanent coverage if you retire early. If you are getting free coverage from your employer, it's going to be a mixed bag. You're going to say, I'd love an individual plan, even at half the price, but it's not half the price because my employer is paying for it.
Right.
But help is on the way there, too.